Welcome, everyone. My name is Marshall King. I'm the Director of Communications and Marketing for the Community Foundation of Elkhart County. This is our Thursday afternoon coffee talk, and we appreciate all of you taking the time to join us. These have been an effort through the Learning Center and the foundation as a whole to try and connect people and offer some resources during this strange time. So on this cold, sunshiny day, we're glad that all of you can take some time to join us to talk about bridging the language barriers in our communities. So some of our senior staff is normally on this call, and they aren't today because our foundation board is actually meeting virtually as well. So that's why I'm helping moderate as opposed to Jody Spataro, who normally does that. And then Ashley Jordan, who's Director of Access Service, is also helping coordinate everything. So, and with us today we have Jason Shenk. Jason's played a range of roles in our community, and for 8 years he was coordinator of the People's History of Elkhart project and has worked at a number of nonprofits in our community, and is now the principal at Watershed Consulting. And so he helps the Community Foundation and works in the Tolson neighborhood and works at some asset-based community development. So he's helping all of us to increase opportunity and diverse participation. And so Jason today is gonna tell us a bit more about a project that's coming together in our community. It could be called, in some instances, it's called teletranslation or remote translation. So Jason, I'll hand it over to you, and you can tell us a bit more about this concept.
Great. Well, it's good to see some familiar faces and new faces, and have other people joining us on the phone or maybe by recording later here. So I'm going to share some stats and tell a little bit of the story of how this initiative came about. But first, Ashley, if you could share the screen there on the presentation. Just going to give a little context here for these times we're all in. So that it's comments I'm going to point to in the second slide there, Ashley, if you don't mind. It's from Dr. Anthony Fauci, who many of us have been seeing a lot of recently. You can read it there for those of you who have the video. He was reflecting on the context of the AIDS epidemic that he was actually through. He's been in that position actually nationally since the 80s, but reflecting in just last week on health disparities the African American community is experiencing in this moment. Talking about, in case you can't see the video, in the middle of a crisis, it can shine a very bright light on some of the real weaknesses and foibles in our society. So that's obviously broad, that a lot of us are learning a lot, have learned a lot in the last month. Some good things and some really challenging things about our families or our community, our society. Just on a personal level, and I have a 2-year-old. Until about a month ago, I thought I was really good at not giving sweet and sugary drinks, but sometimes you got to get through how you can. So yeah, that's just on the personal side. We're going to be talking today about language and language access in our community. So if you could go to the next slide. The big picture here is here in Elkhart County, the U.S. Census says that there are close to 40,000 residents here in the county who speak a language other than English at home. And you can see that of all the school districts, each school district actually in Elkhart County has seen an increase in English language learners in the last 2 years. So you can go on to the next one there. And just for one example, one of those school corporations, Maryland Torres, actually helped connect us with some of this information. This is just a sampling of one of the 7 school districts. These are some of the languages that are happening in our community that our neighbors are speaking at home and are most comfortable with. You can go on to the next one. And so the broader context, a lot of us are functioning, trying to do our best in the midst of all this. And the Civil Rights Act of 1964 has some relevant guidance about for non-discrimination, and specifically to the issues of language, national origin. That the non-discrimination based on national origin has been interpreted to include language access, right? So that wherever I'm born, whatever language we spoke in that country, I should be able to access programs free of charge in an accurate and timely way that protect my privacy. And that applies to any program receiving federal financial assistance. So that's just some of the big picture framework. And maybe I'll just pause if you want to come off screen sharing for a minute, Ashley, just to see if there's any clarifications or questions. I'll share a little bit about the story of where we're going, the initiative that's developed sort of in response to some of that. But just want to take a pause. If you can go into the chat or come off mute, just if you want to add any comments or observations. So I know I didn't give you any notice that was coming up, so I'll try to give you a little more notice, but feel free to just chime in as we go along in the chat. Marshall and Ashley and I will be watching the chat to try to incorporate those. So I'll just keep going. Feel free to pop into the chat and we'll just roll it in. So I'll just go with the story then it was almost a month ago. Ashley, if you want to, you can just watch the chat then. That was just the screen sharing that I was going to do. Thanks for that. I was talking to a friend of mine as the governor made the order, the travel restrictions, and people were starting to wonder what this means about work. And a friend of mine says, you know, there's another friend they had who's worried about being able to pay rent if we're not able to work. You know, there are stats, there's something like almost half of people in the United States don't have $400 to make it through an emergency, which is what many of us are living through right now. And wondering about paying rent. So I went to the 211 to say, okay, where are places that help with rental assistance? And it directed me to the trustee's office for where that person lived. And this person speaks Spanish. And so unfortunately, so I called the trustee and they say, no, actually, we're just trying to figure out how to stay open. We have some older folks here who work in the office. So we're trying to protect, you know, our workers. And then, so if you go there, then you go to and if they can't help you, you go to another agency, and that other agency actually doesn't speak Spanish either, which made me think, when I worked at Maple City Healthcare Center, we had, in addition to a number of bilingual staff, a language line where you could call, basically dial a number, punch in a code, and you'd have somebody on the line who spoke any number of hundreds of languages, actually. So it made me start to wonder, could we do something like this, deploy something this more broadly, especially in this time when we want to be sure that everybody in our community has access to the resources they need to be safe. It's always important that our neighbors are safe and feel the support that they need, but especially in this time, it's even more clear than normal that if people aren't getting the support they need, then that affects all of us even more clearly. So that, starting to feel the sense of the potential gap there, started to look into some information, talked to, through the United Way, the head of the 211 call center, and said, do you already offer something like this? And they say, you know, we can, but you have to wait to get our navigator on the line. You have to call the 211 center and wait, unfortunately, sometimes a quarter of an hour to even an hour to get somebody on the line. And then they have to stay on the line with the interpreter. So you're, and they're really trying to keep their wait times down. They're doing some things to expand their capacity, but they actually don't advertise that they have this interpreting capacity because it's so clunky. It makes people wait sometimes up to an hour to get an interpreter. And so if I say I speak Pennsylvania Dutch and I walk into Church Community Services, I'm waiting there for an hour with the person who's trying to give me rental assistance. But that's not a best practice. That's not timely assistance. No one is trying to do that. So, start doing some more research. Talking also to folks I know who have or work closely with folks with limited English proficiency, trying to say, what are the barriers you're finding, right? Things like if someone wants to make a report of domestic violence, in some cases, a staff member might be in an agency, might be bilingual, but needs to be out of the room for certain legal reasons while certain forms are being filled out. Or someone who's a victim of a crime is going to an agency that can help with restitution, but the person might not know, and they might think that they're being asked to be involved in a legal matter when actually their benefits are seeking to be provided to that person. So getting examples like this that are unfortunately some of these gaps and barriers that we're talking about. So I raised this conversation with folks at the Community Foundation, and long story short, said, yeah, we need to look into this. We need to see what we can do. This is a real gap in our community. So we've been working together with folks who are trained interpreters to say, what are some of the best practices here? And some folks working in the community as sort of cultural ambassadors to say, unfortunately, some of the agencies themselves might not know what the people they're not seeing because people aren't going there, or either just sometimes that loop doesn't get closed, right? Or that feedback doesn't come through. So how can we find the people who really know the most about what the gaps are in our community as we're identifying sort of this needs assessment? Which brings us to where we're at now is trying to get more feedback, like from you all. So there'll be a chance to, we'll want to hear your feedback here in a minute. But we're working to develop sort of a pilot strategy, trying to get it out as quickly as we can while still maintaining quality, that we have best practices in place, but also we want to get it out, right? So the idea, long story short, being that, say in this case where I walk into church community services, maybe it's Vonda I'm talking to. Vonda can call up a number, and within 30 seconds or under a minute, she has someone with access to over 240 languages who can then just be on speakerphone or dialed in through a phone system, a conference call basically, who can do simultaneous or consecutive interpreting to help us negotiate whatever interaction we need to have. And so that I can see if I can access the services there. So we're rolling out some of how would this be implemented, who are the priority agencies who might be able to make use of this. And so that's one thing that we're looking for feedback on from you all. What might be good candidates for this pilot? Is there feedback on the proposal? Does it sound good in certain ways? Do you have concerns about it? Does it not go far enough? Yeah, so I'm curious what you think, and I think I'll pause there and open it up for questions either in the chat. Yeah, thanks Marshall for putting that there, or you can go on mute, and hopefully if you haven't found the chat, hopefully we can see you going on mute, and we can have a little conversation here before I know we're going to hear from Missy and the folks from Center for Healing Hope as well. So.
Thanks, Jason. What just a bit of a clarifying question, like, so as you and Tara, we'll let you chime in here in a little bit, but so how would this all come about, and what would next steps look like? I mean, I think a lot of us on this call are probably going like, oh, that sounds like a really good idea, and it seems like something our community could use, but what would be the process or the needed pieces to pull together to make this happen?
Sure, thanks for asking. So what we're doing right now is getting some quotes from different vendors who provide this service to a number of agencies already in our community, but not comprehensively, right? Because organizations have to fit it into their budget. It might not be a huge expense, but right now a lot of budgets are stretched. And so the Community Foundation is looking at what it would look like to underwrite the cost of that service, to pilot it for a period of time. And we're still working out those details. But basically, if an agency would participate in the pilot, they would get the information and it's fairly simple training on how to use the system, and then try it out and gather data, and we can evaluate, see how it's going, and see if it's possible to expand it for a larger access beyond that pilot.
Okay, that's great. Tara, did you have a question that you want to go ahead with, or a comment?
I think you're on mute.
Okay, thank you. You just unmute me. Can you hear me?
Yeah.
Mm-hmm.
Okay. I was just wondering if there was a reach out to even state organizations, just like the Office of Minority Health with ISDH, And I know they control as well from that aspect as the 211. And I mean, this conversation has been long taking place over the years, early 2000s, and you might want to see what other models may be out there, because I know in my time of just serving this community, you have so many different dialects when you look at the different languages. And I was just online today as I think about that, and we were looking for information in those languages just for the COVID-19. And to see that even our state Department of Health only have 3 languages, and that's English, Chinese, and Spanish. Whereas other organizations like Minnesota may be reaching out to about 20 different languages because it continuously grows. And I think about what we might have, even just like the German Dutch, the Chinese, the different dialects, just in those languages alone. So I guess my question is, if there was a reach to see what other models that may be out there, and I think just having this group come together, maybe, like you said, give you some other avenues of what is best practices.
Great, I appreciate that, Tara. I'd love to follow up with you offline to figure out who the contact would be and how we can learn from what folks may have already been developing. Thanks.
Sure. A couple comments in the chat. Mona Livingston from United Way of Elkhart and LaGrange counties points out that 211 does translate. And Tessie from La Casa points out a program that they're kind of working at and enacting. So thanks for the comments in the chat. We do have with us today, as well as Jason, Missy Schrock, who's the new executive director at Center for Healing and Hope in Goshen. And she, Center for Healing and Hope works with a range of folks in our community who need health care. And so we wanted to just hear from Missy for a few minutes about how they're helping folks in our community, how language interfaces with that, and how they're addressing this larger issue of trying to help the vulnerable populations in our community. So, so Missy, we'd love to hear a bit from you.
Thanks, Marshall. Thanks for inviting me to be part of this. I have Julia Schmidt here with me. She's our Immigrant Resource Coordinator at CHH. I guess just as a brief update on what we are doing and how things have changed for us over the past month. So I'm in my 5th week of employment here, and during my first week, we were aware of the coronavirus and all of that kind of stuff. And then my 2nd week, everything blew up. And so everything is different now. But that's all to say that we are trying to do our best to stay open and adapt and continue to serve vulnerable populations in Elkhart County. We are still taking urgent care telemedicine calls from people who have a general medical need. We have a COVID-19 screening hotline that people can call from 10 to 2 every day, although I think we're going to back off of Sundays. We are continuing our Diabetes Alliance program, helping people to maintain control of their diabetes, because that is a major risk factor for the severity of COVID-19 if a person gets it. Beginning maybe not next week, but the following week, we are going to start doing on-site point of care testing for COVID-19 antibodies. And so we'll be doing, we have 3,000 tests coming in the next month. And we will be testing people for antibodies, but only people who are uninsured. We will not be testing people who have insurance, because those tests will be covered by insurance. We received a generous grant from the Community Foundation to purchase the tests that we need in order to do this. So how all these changes interface with our ability to do our work. One is that the majority of our staff are bilingual, and that has been a gift. And I think most of the staff in the clinic have been bilingual in the past. We need more interpreters to work with our providers who are not bilingual. We need volunteers to help Julia with the Kroger food card program that we decided to do about a month ago. We decided that we would open up our, we were getting a lot of contributions to help with food insecurity among the immigrant population. And so we decided to do a Kroger food card program that it's not, the window, it's not Salvation Army or other places that are giving out food boxes. What we're doing is we're allowing people to have the flexibility to purchase food, over-the-counter medicines, prescription medicines, gas, cleaning products, personal hygiene products, and have some agency in the things that they are purchasing when they go to the store with these Kroger food cards. We had a tremendous response. Julia was overwhelmed, and may still be, with calls from people who are needing this kind of assistance. And we have so we got $8,000 worth of cards to begin with. We're probably going to have another 6,000 at the end of May, end of April, early May, to be able to distribute. But we need volunteers who speak Spanish to be able to screen all of the calls that we get to make sure that they fit the parameters of the program that we have developed. So we are in need of people who can translate, who can speak directly to our clients and patients on behalf of the center. And we actually are looking to hire additional staff who are bilingual to work in the clinic. Yeah, I think a program like what you're describing, Jason, would probably be really helpful for Julia. I don't know if it would be as helpful for the clinical side, just because of HIPAA laws and other privacy issues that have to do with medical care, and then the kinds of waivers and such that our volunteers need to sign in order to interact with patients. But yeah, that's pretty much what we're doing.
Okay, Missy, thank you. You, while you were speaking, somebody did respond to say that Radio Horizonte, the bilingual radio station here in Goshen, Tessie works with them and might be able to put a call out for you on your behalf for this. But you raised the question, or you raised the point about the local need, and Jose Chiquito in the Galvan in the chat asks, about the longevity and the sustainability of this, and whether there's an opportunity for us in Elkhart County to create some bilingual jobs, utilizing some local talent for a service like this. So we'll let Jason respond first. Jason, do you have thoughts on that?
Yeah, I think it's a great question. And there's a model in Fort Wayne, actually, the Language Support Network, that does something very similar to that. They coordinate interpreters and also do training support and support for agencies who want to work with interpreters on how to do that well. That one thing that probably many of the people on the call here know better than me is the best practices when the health guidelines allow for it is in-person interpretation. Obviously, there's a lot covered by body language and broader cultural competency, which Liliana, I think, is speaking to in the comments as well, that is sort of a stopgap measure for the time being. But we're trying to see how we can roll it out, especially in times of social distancing. But with the idea of doing sort of a trial period and evaluating both what did we learn, and so yeah, I think if there are people interested in organizing sort of a collective effort to do something like this, or like what they do in Fort Wayne, I think that would be very, very interesting. Obviously, I can't speak to what the foundation or others would do, but clearly there's a need for interpretation of services, and also coordination too, because some people unfortunately think that having a child translate is appropriate, right? Or are forced to get by with something like that because they don't know where else to turn, right? When that actually can seriously compromise care, both in health or outcomes or even legally. And yeah, maybe I'll pause there.
Missy, did you have any thoughts or want to weigh in on that at all?
I don't know if I have any thoughts, Julia.
Okay.
No.
All right, great. We're close to the end of our time together. We normally try to end these at about a half hour. If there are other questions, anyone's welcome to unmute themselves and speak up, or raise it in the chat. We do want to potentially we realize that serving vulnerable communities and raising cultural competence and bringing our community together in some ways, in some important ways, is a longer conversation, far, far longer than a half-hour Zoom conversation. And so we are interested at the foundation in having a larger or a broader conversation, or taking a deep dive on this. So if any of you want to be a part of that, feel free to note that either in the chat, or you can get a hold of either Jason or myself. We'll put Jason's email in the event for this on our website, inspiringgood.org, or my email is just marshall@inspiringgood.org. So I'll put that here in the chat as well. As I don't see other questions at this point. Jason, is there anything that you wanna leave it? Jason or Missy, is there anything you want to leave us with? Kind of final words or next steps?
Yeah, thanks for that, Marshall. I think that's really important and speaks partially to Liliana's point. I know, Liliana, obviously that your folks with the coalition have done some really important work providing access and doing some bridging, right, cross-culturally. And also I know Nikisha Eileen Alexis is here who does that work. The foundation has partnered with the Anabaptist Mennonite Biblical Seminary, who's developed some real skills around broader cultural competency, and that they're making that service available. So I know Liliana and Nikisha are both real resources here within our community on those broader questions. So next steps to the point from the chat, you could respond in the chat or to Marshall or myself in the same way for this broader conversation with, are there good candidates you think for the pilot that you'd love to see have a chance to be part of this earlier in the rollout, either in your own organization or one you're familiar with, or another organization in our community which you think could really make good use of this service, or any feedback still too. Obviously this hasn't rolled out yet, so we're still wanting to build on the good conversation here. If there's other feedback as you think about it, feel free to be in touch with myself, or Marshall can put you in touch with me as well.
Great. And Liliana, did you have a question or a comment that you wanted to raise?
Can you hear me?
Yeah.
No, basically, my comment that was based on a conversation with Jason yesterday is like, we know that we have a long-term, from the past, lack of cultural sensitivity in the county. So we know that this is kind of the first step. So it's more thinking in the long term. Is the community foundation considering to get a training or train the trainers for interpretation? Can we thinking in long term, as Jose Miguel Chiquito was mentioning, like as we're creating a way of employment, as you mentioned, 52% of the county, or 58%, the first language is no Spanish, is no English. So we had tons of people that could be eligible to take this as a serious job opportunity. And also, we don't have to reinvent the wheel with non-for-profits that are doing a great job, but sometimes they cannot stand their wins because the language barrier. So how can we bring that extra support to be able to provide cultural competence services? Because of course we know right now we have the social distance, but in the long term, it's nothing to do to have a phone person translating for you versus the face, the body language is huge. It's huge. And even that services should be extended, even if you feel, I always use as an example myself. So if I go to the doctor, they're gonna tell me they have cancer, I wanted to hear it in Spanish. I wanted to know what is going on with my probability of life or treatment, because immediately there are studies that your brain gets switched to your first language. There are tons of studies around that. So that as well helps to create a little more close community around, more sensitive around not just health, but all these basic needs that we are facing right now. But I'm just kudos for you for what you are leading, but as well like a kind of inviting you to think bigger and how we can create a long-term program that can really respond for this huge lack for the county in general.
I thank you so much for raising that point, both on the cultural competence, but then also just how to think about this in terms of the long-term and sustainable way. So I think one of the things, we're, a number of you have said that you'd love to be involved as we move forward. Feel free to, again, reach out even after we're done here today. But we kind of consider this as starting the conversation. And so we're excited to move forward with this, taking some of what you've given us today and what we've come to together to figure out the best way to move forward. So the one thing I do know is that I think a good sense of the interpreting resources that we have among us already would be helpful. I know it would be helpful to me at the foundation to have a better sense for that than I do, as well as, so who are the interpreters among us that we can rely on in our community? Knowing that would be a helpful first step. And so I think that might be something that we can tackle together as well. And as we figure out how to have a larger conversation here, we'll invite you again. So with that, I think.
I just wondered, I was curious about, could I say something, Marshall?
Yeah, go ahead.
Yeah. In terms of cultural competence, hi everyone, my name is Nikisha, that not only the ability to be bilingual, but also representation is really important. And so it would be very easy to have a slew of interpreters who were white persons that could speak Spanish. And, of course, there's a need for that, and I'm glad for people who do that, but also, we know that representation matters for the way that people feel comfortable and in which people understand cultural nuances. And so that's something to be thinking about as well, that, we're hiring people that can be a whole package. I think the other thing too is, I want to say thank you to the Community Foundation for doing this work. And also, I know there are ways that the Community Foundation itself can be challenged to diversify its own staff, to diversify its own linguistic capabilities. And so as you all are leading others, and you all know this, right? But a continued invitation to be modeling that as well. So thank you.
It's a helpful reminder. So thank you for that. Well, thank you all for joining us today. and for all the great information that's included in the chat. So we'll save the chat so that we have your addresses. Thanks to Jason and to Missy and Julia for joining us today, and for your great comments and questions. So stay safe. Hopefully we'll see you next week. Tuesday at 10 a.m. will be our next coffee talk. So again, thank you all for joining us today. Have a great day.
What we're able to do with Goshen Health, we have in-person interpreters, which is always the gold standard when you can get an actual in-person interpreter, for all the reasons that people have talked about: body language, cultural nuance. But there is a role for phone interpreting. There's also a lot of video interpreting that's happening more and more, kind of like what we're doing right now, but with interpreters. That's been used for quite some time with sign language interpreters already, so that does exist. But like here at Goshen Health, we have an outside vendor. There's a company that Goshen Health contracts with for the phone interpreter. So if a patient calls in that speaks Arabic or Burmese Chin or Haitian Creole, not just Spanish, there's lots and lots of different languages. The phone system is able to connect that person to a qualified medical interpreter. And now that's obviously on whoever that company is, whoever the vendor is that you're contracting with. They have their own screening processes and hiring processes to make sure that the interpreters that they're hiring, it's a qualified medical interpreter and not just a quote, bilingual person. But from what I understand, all of the companies that are doing remote interpreting nowadays have really come a long way from decades past, and their processes and procedures for hiring and testing people and making sure that people who are interpreting have passed all their, whatever the appropriate competency testing is. And I know that like the system that we use in Goshen Health complies with all of the HIPAA, all of the confidentiality stuff. So it definitely works. I mean, and lots of hospitals and clinics all over the country use similar things. So it is, stuff like that does work, and it does take into account the confidentiality pieces.
All right. Anyone else?
So something from
Missy had a question. I'm going to go ahead and unmute her.
Okay. I was trying to see, so Missy's not on, is she?
No.
Well, it's okay.
Yeah.
I'm going to connect with her afterwards, so
Great.
it works.
Okay.
So I was just trying to get an understanding because I kind of zoned out at the beginning of our call. So you were saying about this initiative, or how do you want to call it? You said, is it like an initiative? Can you just give a quick summary of it? Because I listened more with Missy's needs, and I just kind of wanted to see what the initial conversation was.
So the idea is that we're looking at both video and teleinterpretation, but it seems that teleinterpretation is easier to deploy in a wide variety of settings. And it seems like video interpreting is sort of best practices for medical and psychology often. But so teleinterpretation, basically where I'm a client, I walk into an agency, and if the person working in that agency or on the phone, or either I walk in or I call, and if the person I'm interacting with in the agency doesn't speak my language, they can dial in either in a conference call or dial someone in. Often people do it on their cell phones even, that they can just punch in a code and then have access to someone who can interpret and then help me as the client access the services that the agency is seeking to provide. And so then the back end that's how it works for the user. And so the back end that we're developing is how would people get the code, right? What are sort of the best practices that we don't just toss out the code willy-nilly and say, oh, great, there's interpreting now at X agency, if they don't actually know how to use it. They're not actually, if it's not comprehensive in the agency, if it's only one department, let's be clear in communicating about that, right? And are there forms that need to be translated as well? So what are the boxes we need to make so that we're doing due diligence, that if we're saying that interpretation is being provided, we're actually trying to support the agency in really providing that. And so we're working with some people who this is what they do every day to figure out what are the best practices. And I'm excited to hear more from Tara, your contacts, or other folks on how we can build in something that's as effective as possible, but also as simple as possible, because the agencies now more than ever have a lot on their plates, right? So how do we make this as streamlined as possible so that it can be doing the job it needs to, while also building into the systems that already exist, and hopefully, like folks have been speaking to, invite a broader conversation about organizations supporting a wider range of folks from throughout our community.
Tara.
Yeah, I don't find the raised hand.
There you are.
I just wanted to follow up with whether this is being sorted in a way as cultural competence, or we're just looking at interpretations and translations. Issues. And when I commented before, because this is not something new, but I see where you're trying to do is a reach to actually serve our community, as we see population is more of the increase in growing group. And that's why I put it out there, so that we don't just whoever is going to sit a part of this committee or task force moving forward. Because with the whole, as Nail stated, there's a lot of legal technicalities that's involved when it comes to translating, especially on the medical side, as we know throughout the years, as we have experienced this. And we don't want to make sure that we jeopardize crossing that line of HIPAA and who is actually translating the information. And I'll go back to say, because there are so many different dialects out there, that we really do want to depend on a reliable source. So I think in the process of gathering information and exactly what is going on inside of Elkhart County, and those who may have to reach in to utilize those services. But again, separating what is cultural competence and what we're trying to do to make access to the delivery of interpretations and translations.
Thanks, Tara. I think that's an important question. Can I just make sure I'm catching what you're saying? That are you sort of pointing to the fact that cultural competence is like a broad umbrella that covers a lot of different things, and this is like one piece of the pie within that?
Absolutely.
Mm-hmm. Yeah, that we want to make sure that we don't get so excited about the piece of pie we're about ready to eat, we forget that there's a whole other pie there too.
Right, right.
Mm-hmm. Yeah, it's really, really important. Thanks for touching on that.
Jose, do you have anything you want to chime in with about cultural competence and any of this stuff? I know you wrote a couple good comments in the chat, but I don't know if this discussion about cultural competency is bringing anything up that you might want to speak to.
Hi, Heather, and yeah, thank you. Yes, I think it's important. I think part of that was, thinking that we probably have enough people here that will need a job anyway in the next few months. And when we talk about diversifying our economy, I think this is a really, important opportunity too, despite the unfortunate circumstances that we're finding ourselves in. I think there's a lot of room for growth in that way. Making use of people who might be wanting to, switch career directions. That and sort of adding to the pie would be, there's cultural competence, there's interpretation, and then there's translation. I've been engaged in the last few weeks with the Elkhart County Food Council, and they did this excellent job of compiling a great online resource of all the sort of food resources in the county and in the surrounding area. And then I saw, wow, this is such a great resource, but it's not in Spanish. And so I said, okay, I can help, and I can help translate this to the best of my ability into Spanish. So I did. And then like you have to realize, you know, wow, there are a lot of different words that might be different for, you know, a Mexican who speaks Spanish versus a Venezuelan who speaks Spanish. So I'm not Venezuelan, so I don't know. So I had to really do a little bit of research on how to translate a word into something that's a little more universal. So, I mean, I think the biggest thing with that was in helping the Elkhart County Food Council translate their COVID-19 resources into Spanish was one, okay, yes, I did the translation and now it's there. We share it on social media. But two, okay, now I did the translation, but there are all these links to all these different wonderful nonprofit organizations in Elkhart County and in the area, but those websites are not in Spanish. Those resources, you know, it's not clear if they have bilingual capacity. So now in the Elkhart County Food Council, we're talking about, okay, we need to reach out to these people, to these different organizations, and make sure that they have, you know, capacity to translate, or we need to find people who are, you know, willing to volunteer and at least translate the information that's on their pages to Spanish. So I think you opened up a whole can of worms here beyond just interpreting services. That goes into, we need to translate everything from written to spoken word.
Thank you, Jose. That's a great point, and I think in many ways that has framed well the work that is ahead of us and that we are trying to undertake. You know, back to Jason's quote that he initially, you know, from Dr. Fauci, you know, the times like this point out your vulnerabilities and the areas that you need to work on. So, I think we've gained a lot of together some great understanding about, you know, some of the next steps that we do need to take, and we've gotten you know, some really, a lot of you have stepped forward and said, yeah, let's do this work together. Let's have this larger conversation and figure out where we can take this. So I think it's a good place to leave this conversation for today and kind of figure out, you know, we'll talk some with I'll talk some with the other folks at the foundation, and then we'll figure out a good way to have this next piece of conversation and involve all of you as we move forward into that. Okay, Tara.
I mentioned even from the federal level, the Office of Minority Health, but also our state lead office, which is, as a resource, Indiana Latino Institute. That is a great resource and has been down in that area for many situations that we may need to just tune closer in for Jose and for Nail. They do exist. So.
Okay, great. Thank you for that. All right. Well, once again, thank you all. Thanks for taking the time and for leaning in with us to make our community stronger in this way. We're deeply grateful to be in this work with you. So thanks for everything you're doing. Have a great day.